Alright class, let's start our injury prevention PowerPoint. In this lecture, we're going to talk mainly about different types of protective equipment and also certain safety standards, like NOC that those pieces of equipment have to go through to stay regulated. Alright, so protective equipment, it just shields different parts of the body from certain types of injuries without hopefully interfering with whichever exercise or activity that athlete is completing. They can also be used on return to activity after someone has been injured to help protect a specific part that maybe the whole team might not have to wear, but after an injury, certain areas will need extra protection for that athlete to be medically cleared to play. So there's tons of protective equipment out there. Helmets, shoulder pads, face shields are probably the most common, but then you'll also see shin guards, wrist guards, gloves, etc. So when we're talking about helmets and shoulder pads, we are mainly referring to football, which we don't have here at Solano, but those are the ones that have very strict regulatory agencies and approvals, and that's because they're protecting the most vital organs of the body, so the head and brain, and then also the shoulder pads, which helps protect the ribs, clavicles, and sternum, which in turn protect your lungs and your heart. Also, running shoes are considered protective equipment, even though a lot of people don't think of them when we think about protection. But running shoes are a great way to help prevent injury because if they fit properly and they fit well and are comfortable for that athlete, then they can avoid a lot of injuries. Alright, so suitable equipment. Equipment should be used according to the capacity of the athlete, so that just means whatever the athlete has to do and all of the movements that their body has to perform, their equipment should be able to move with them. This is just an image here about different parts of the shoe. There's a lot more to think about when you're buying a specific shoe, especially a running one or one that you're practicing in, and that's because a lot of different brands and types of shoes have different toe box capacities or longer midsoles. So really it would be good to go to a store and get fitted or talk to an orthopedist or an athletic trainer to help you find whichever shoe is right for your activity and your body type. Shoe fitting, this is just the obvious that they should be long enough to extend all of the toes without getting kind of pressed up against the front of the toe box. They should be wide enough, which we see a lot of problems with. Sometimes athletes tying their shoes too tight or the shoe is actually too thin to begin with. And then we also have protective equipment that you can buy off the shelf. So these are things that are usually pre-made. They're pretty much one size fits all. So these are things like inserts for your shoes, neoprene sleeves, maybe an ankle brace that you can slip over your foot like that bottom right picture. And these are very easy to obtain. You can buy them at a CVS or a Walgreens or sometimes a Dick's Sporting Goods store, but they're not going to be customized to each athlete. And then we have custom equipment, which is a knee brace like you guys are seeing in this slide. This is something that is going to be constructed specific for that athlete, and it's going to help fit them much better and be a lot more comfortable and meet their needs better. It's going to be specifically sized. It's going to support whatever that athlete needs supported specifically, but the downside is that they usually cost a lot more, and insurances usually won't cover it, and they are usually prescribed by your athletic trainer, physical therapist, or your doctor. Face protection, there's a lot of different kinds. These are the 5 categories that we put them into though. Full face guards, throat protection, mouth guards, ear guards, and eye protection. Eye protection is glasses or goggles and sometimes contact lenses as well. And also something that people don't realize, but the pre-participation exam is one very, very important piece of protective equipment or a protective examination. And the reason for that is that it's going to help screen and look for any sort of existing conditions, illnesses, or pre-existing injuries that an athlete might have when they're coming into the season. And then it can also help prevent injuries by catching things early. So if someone's walking a little bit differently, or you notice a difference, on one side of the body versus another, you can target it early and help prevent any sort of consequential injuries from that issue. Environmental factors can also cause a huge amount of stress on an athlete and be very dangerous. So here in California, we usually have the heat index that we use. We don't have a lot of issues with the cold in Northern California, but we do see a lot of issues from the heat. So environmental stresses are going to adversely affect the performance of the athlete, and then sometimes it can pose very serious health issues. And then uneven, wet, or icy surfaces will cause extra falling, sliding, collision, all of that, which can lead to injury. Hypothermia is going to be when the body temperature is elevated. So this is what we see most often. Hypothermia just means your body temperature is getting too hot above normal. Hypothermia is going to be the opposite, which luckily we don't deal with very often, but it does happen in states where you have a lot of rain, snow, and ice. So dressing in the proper clothing, layering up, that way you can take off layers as you get warmer and start to play and warm up in your sport. So we also have something called the flash to bang theory that helps protect against lightning strikes. So some of you may have heard of this before. Luckily, we don't have a lot of thunderstorms, not a lot of lightning here either, but every once in a while we do have to stop a competition due to lightning. So if you observe lightning, the way to perform the flash to bang theory and find out how far away the lightning actually is you have to look at the lightning and then count until you hear the thunder afterwards. So they come at 2 different times. So you're going to see lightning, you're going to start counting in your head, counting the number of seconds until you hear that thunderclap. Then you're going to take that number, so let's say it was 10 seconds, you're going to divide it by 5, and that will tell you that the distance is 2 miles away. So it's a very simple calculation, but it is something that we have to do for sports, because depending on how far away it is, we will have to stop and then go inside to a safe place, wait inside for 30 minutes, then we can resume activity if we haven't had any thunder or lightning for the previous 30 minutes. All right, counseling athletes is also a way that we can help prevent injury in the long run. So as an athletic trainer, we are healthcare professionals, so we can counsel athletes on a lot of things outside of just sports and rehab. So we counsel them on nutrition, so trying to get people in that target range for carbohydrates, proteins, and fats. We can help them with weight control very safely and slowly if they have to gain or lose weight. Any bloodborne pathogen awareness, so that would be this picture on the right, OSHA guidelines. So if there's blood on the field or if there's any sort of body fluid, how to take care of it and clean it up properly. That way we can prevent bloodborne illnesses. And then also substance abuse awareness. Nutrition. So the reason that we counsel athletes on this is because sometimes at the college level, athletes haven't taken that nutrition class or don't really know how to look out for themselves completely, and they are not getting the proper nutrients to be able to sustain all of the activity that they have to do on a daily basis. So if they don't have the proper carbs, fats, proteins, they're going to deplete all of their glycogen. That's going to cause a reliance on fat and protein stores, which will break down protein, which can sometimes lead to soft tissue injuries in the body. So this is one direct way that just not having the proper nutrition, carbs, and sugar in your body can actually lead to soft tissue injury, which are things like muscle strains, ligament tears, tendon tears. And then also intense training can cause skeletal muscle breakdown. And then so if you don't have proper protein, carbs, and fats, your body can't build back that muscle as quickly as it normally would want to. All right, and at practice, making sure athletes stay hydrated. So we are also in charge of making sure that the athletes are getting enough water, taking the proper amount of water breaks, and all of these are regulated depending on sport. So the first 2 weeks of football are going to look a lot different, and there are mandated water breaks for certain amounts of time and however often you need them, depending on the temperature outside and where you are in your first 2 weeks of your conditioning protocol. So we're in charge of all of that. Then we also have preventative taping, wrapping, and bracing. So if someone has a predisposition to spraining their wrist, we can put tape on it to try to prevent it. And then the basic guidelines for trying to prevent injuries is if something hurts, don't do it. We can do a modified version of it in a very safe, controlled environment, but it's not worth pushing it and further injuring yourself just to complete every exercise. When you're working different muscle groups, you want to rotate every day. You want to stretch enough every day, but not till you feel pain, only till you can feel a moderate stretch. And then avoid ballistic or bouncy stretches because that can actually tear your muscle fibers. And then here I just have a few injury classification and recognition slides that you will need to know for exam 1. So this talks about forces. So the ground reaction force, that's going to be the force that's exerted by the ground on your body, and it's going to be equal and opposite from the force that you exert onto the ground. We also have internal forces. So that is our muscle contractions. So our muscles are going to shorten and lengthen to try to move our bones, and that is an internal force. And then we have 3 main stresses that are put onto our bones. So tension is any pulling or stretching. So we see those types of injuries with muscles or tendons. When they have tension stress on them, they will be pulled apart too far and those fibers can tear. Then we also have compression, which is just extreme pressure or crushing. So that will usually cause damage to a bone. And then we have shear forces, which are at more of a right angle. So that can happen to your joints or sometimes bones, like that picture on the right. That's an image of a shear force fracture. Then we have some secondary stresses: torsion, bending, torsion compression, tension torsion. These are just versions of twisting and bending different body parts, and then different combinations of those. And that's it. Make sure you guys check out the PowerPoint slides and also listen to our other lecture for this week.